Just so people know, this is not a room that's used for medical stuff. And if it were used, I mean, we'd have to be like super deep cleaned. This has been my personal office for a couple months now, so there's all sorts of bacteria living in here. There you go, buddy. All right.
Cheers.
Here we are. Okay, let's see if these shortcuts work here. So we got me, you. Both of us on 1. You're on 3. I'm on 2. Perfect. Okay. All right, dude. This is it.
There we go.
I can't believe we're
You
finally
rolling?
here. We're rolling. We've been rolling for like the last 15 minutes. But before we get started, let's make sure your
Opening prayer.
No.
No.
Let's make sure your audio sounds okay.
Okay.
You talking to get it close to your mouth.
Testes. 1, 2, 3.
Definitely 3 in this day and age. That's probably possible. No. Yeah.
Maybe.
Not sure why you'd need it, but after you get TRT from Thunderbird Men's Health, it's almost like you did have a third.
It's as if you do.
Yeah.
Should I use my stage voice?
You can use whatever voice you want.
Project.
That's right.
All right.
We had some audio training with some singing training, speaking training when we were kids.
That's right. We did. It was Judith LeBain.
What did you learn from that? Is there anything that you picked up on?
I learned that I hate voice lessons. It was more about, it was like just singing Scottish music and
Right.
It was it taught me that my parents have certain values and their kids may not also share those values.
No, that's so true. That's totally true. Right. And
as a parent, it's definitely formed my parents were amazing, great parents, but they certainly wanted us to excel in music. And I didn't have much interest in it.
kind of figured out what you wanted to do, what you didn't want to do.
It's true.
Right.
It's true. I love music. Don't get me wrong. I love singing and stuff, but it's just in terms of like doing like lessons and as honing it as a skill. I personally wasn't interested in that.
Right. So I'm not going to put you on the spot and ask you to like sing right now, but maybe if we're feeling better down the road.
Yeah,
we can sing a couple songs
We'll
together.
see.
But I think more than anything, right, it's like an opportunity to kind of see what you like to do, what you don't like to do.
I think that's really the job of a parent more than anything.
Right.
Is to just you're constantly trying to figure out what your kid wants to spend their time doing, and it's parenting is hard because they'll be good at something but they don't want to do it. You're like, but you're really good at this. So,
right.
and that's a struggle. But to find something that your kid is good at, but also wants to do, like that's the golden ticket.
That's really interesting. I think for me, there's certain things in my life now where I'm like for example, like songwriting. I'm like, I want to be a good songwriter, but I'm not very good at it.
But that, you know what? Everybody starts somewhere too at the same time. So if you're willing to put in the hours, and when we learn in surgery training, we talk about the 10,000 hour rule, which comes from, I don't know, I think it comes from the art world when you're talking about like the masters and painting and stuff, that it requires 10,000 hours to become like a master.
Proficient, right.
Yeah.
Right.
But, and that actually has been disproven that in some cases it takes longer than that. It might be a 15,000 rule for some people, and somebody with a certain God-given talent, it might take less than that to achieve it. So, but it's partly why surgery training is so long. Why, it's a 5-year residency because, but when we started, they sat us down and it's like, guys, you're not going to be good at this. You're just not. It takes a long time. It takes there's so much to learn. The textbook is this thick, literally,
Oh, right.
Yeah.
Well, I mean, obviously it's a critical skill that you have to develop.
Yeah.
Yeah,
But
that's
you
cool.
apply that to any other skill, whether it's, music, instruments, writing,
Right.
yeah, flying an airplane.
So we've talked about this in the past. I know that there's a point in your life where you're like, I'm going to be a surgeon, or was it just something that you just kind of figured that you were going to do? I think I remember hearing about, like, I don't know,
Yeah. So, I mean, I
mention
think
of it,
when I was
but
a kid, I was like, I'm going to be a surgeon, but it was like,
yeah,
you don't really understand what that is when you're a kid.
sure.
I think when I was in college, trying to figure out what I wanted to do with the rest of my life, I actually loved the idea of medicine. I was interested in health, the health sciences, but more from the angle of like fitness, and I was into weightlifting and bodybuilding and sports, and I was like, I thought maybe the personal training route was going to be, and some of these guys who make careers out of this, become trainers to the stars and stuff. It's super inspirational. Then, some of the other allied health fields were interesting to me.
What's allied health? What is that?
So that would be everything that's not like an actual provider. So, like radiology tech, or, a medical assistant, or like in my case, I actually was going to go to PA school because I thought med school sounded too hard, too long and too hard. And
so what was the turning point though? Like, when did you finally decide, okay, I'm going to do this?
well, I went to a couple interviews for PA school, one at St. Louis University, and then I went to another interview at Toro University in Vallejo, California. And these interview groups were like, and this is just the reality of what it was, but they were like 80% women, most pretty young. And here I am, like, and then, I had this group of friends that I worked with. I worked at the BYU like health center as a phlebotomist there.
Right. Yeah, I think.
And we were all kind of med school bound, everybody who worked there. And I had one buddy, he's like, what are you doing? Just go to med school. We're all doing it.
Oh, right.
It's like, he's like, you're going to be the same age, at one point or another anyway.
Right.
But I mean, I certainly, it was been a long road, and along the way, I did at times kind of think, wow, I should have gone to PA school. But you can't, there's a certain, I guess, freedom. It would have been a great career for sure, but I just, at the time, knew I kind of wanted to be my own boss. Right. And I realized that, and I was like, okay, this is going to be a long road. Because we had some friends that started PA school at the same time I started med school, and by the time I was applying for residencies, he was well into his like second year of his job. You know what I mean?
Oh, right. So you're looking at him going like, oh, if I'd only graduated early, I'd be farther along. I'd be doing my own thing.
Yeah. And he's, 26 months or 20, what is it? I don't know, 28, 29 months for PA school. You're out and you're working with patients, making a good salary and stuff. But, and then I was like,
but those two are like vastly different though. I mean, like when you compare PA school or you compare surgery, I mean, what you're doing on a daily basis is
it's so specialized now. So it's really like a 6 or 8 year difference in when you finally get out into your career.
But earning potential wise, I mean, how do those two compare now? Do you know what?
Yeah, I know the average surgeon's going to make probably 3 to 5 times in take home pay what what a PA makes.
Right.
Depending on the PA, there are some who are very specialized and are very good at their jobs as well, or work independently and even have their own practices who do quite well as well. But when it comes to like hiring somebody straight out of school, someone who's like a surgery residency finisher or graduate is going to Yeah, 3 to 5 times.
Interesting. So I'd never, I mean, to be completely honest with you, I'd never seen you, do surgery. And obviously that's kind of one of the perks of like working together now, is the fact that I can kind of see how you operate.
Yeah.
But I had a similar kind of experience seeing you kind of do your thing as I did when I saw Tom. He had like, so Tom, our other brother, right? For everybody who's watching, he's an opera singer. And obviously, he's spent a lot of years honing his craft as well and doing what he's doing.
Yeah, he's top of his game.
Yeah, absolutely. And he took a shot at, law school at one point. I think he kind of figured that he wasn't gonna sing for whatever reason. I don't exactly remember why. But I think that watching him sort of like stop law school and go back to singing, like seeing him sing, like to me kind of like brought to mind like, okay, this is what he's supposed to be doing. And I think if we were to put some video in right now, I could totally share that. I don't even know if we could find it, but anyway, long story short, he's amazing. And I think that seeing you in your element and doing sort of like surgery, seeing you doing that same kind of thing kind of gave me that same kind of feeling. It's like, okay, this is Jordan's thing, right? This is Dr. Glenn's thing. So I think I just find that interesting that you sort of like found what you wanted to do. I mean, obviously you're capable of other things, but to me it was like this, oh, okay, he's a professional. This is his thing.
Yeah. Now there's risk involved in that though, and as much as I want to be sentimental about it, the training that goes into becoming a surgeon is, at times it's not fun.
So do you think that in any way, I mean, like your motivation to kind of keep going and doing what you're doing, I mean, obviously, being a father, being a breadwinner, there's that pressure there, but then there's also, what mom and dad, by the way, this is their picture right here. I don't know if you guys can see that very well, but these are our parents. Any pressure, do you think, like in the back of your mind, like, okay, I got to keep going.
Yeah. I mean, absolutely.
I got to be professional like dad.
But at this point, I love what I do.
Right.
And there is a certain satisfaction, 10 years into just being able to like, I can take care of that. I can handle that. Right. People in the community, our friends from outside of work, and they call pretty regularly. Amanda's like an answering service for me for people. They're like, "Oh, does Jordan do this?" I'm like, "Send him over. I can take care of that." So there is satisfaction to that, and it's very satisfying. I can't imagine doing anything else at this point, except maybe I don't know, like. I have fantasies at times about quitting my job and going and like starting a hobby farm, or I don't know, whatever. I have a lot of hobbies too.
Yeah.
I enjoy doing stuff with my hands, but and I think that, I have to remind myself like, hey, you're a benefit to the community and stuff. So, I love it.
It's nice to have the options, right?
Mm-hmm.
To not only be able to like handle all these different things, have different interests, but financially being able to, one day step away and, make a different choice.
Sure.
About what you're going to do. That's cool. So this is our first podcast, as everybody knows. we'll have these numbered and things like that. So we're actually kind of like working through a little bit of the kinks and things. But let's talk a little bit about men's health.
Yeah.
Obviously that's secondary to your main role as a surgeon, but what kind of got you interested in that, and why is that a focus for you now?
Yeah, I think so. I was about 38 years old. I have always been, into fitness. I was actually around 18 years old, I competed in natural bodybuilding contests. So I've always been kind of
I remember that. Yeah.
A meathead to some, or just a workout, kind of guy to some degree. And I definitely let life, kind of lead me away from that. I've always worked out, but sometimes it's been months between trips to the gym. I got quite heavy. But I was, my late 30s, starting to just really feel like my body changing. And continuing to put on weight. Energy was poor. And my doc's like, yeah, let's check your hormones. And sure enough, you know, I was on the low side. And in all the things I can do, I help sick patients. I treat them with surgery. It's very episodic, right? They walk away, they're better. And, you know, but that was like a life-changing thing for me to get on TRT, testosterone replacement. And I'm like, wow, like, how come they didn't teach us about this in med school?
Sure.
You know?
Right.
And so after a few years of, you know, hormone optimization and just getting my life back and then losing a bunch of weight, just feeling like a 20-year-old again. Then we started our men's health actually with some other aspects, but I always kind of had a goal in the back of my mind of being able to build, you know, help guys in this way.
Right.
And as much as I'm a surgeon, it may not necessarily be like, it's not generally thought of as like, you know, something a general surgeon does, you know, provide hormone replacement for patients. But I kind of fell into the role, and I really, I've seen just some pretty remarkable stuff happen just in the short time that we've been doing it. Right. Patients, and these guys really do feel like they get their life back. So we can get into like the nitty gritty, like benefits of hormone replacement, but the main thing for me is just like having that sort of life altering change for patients. Right. Taking out an appendix can be life saving, I suppose, or you know, cutting out some cancer and stuff. And that's like, that will always have its role. Right. But in terms of like long-term benefit to patients, identifying and helping someone with, you know, long-term hormone-related issue can be super helpful.
Oh, that's cool.
Yeah.
So I'm not on TRT yet. I've been thinking about it, and it's probably long overdue for me to actually do that. It's something that I want to do. But is there a certain transition that people can expect to experience as they do TRT? I mean, are there like, is my personality going to change? Like, I know that, you know, the sex drive or things like that. Is there anything that I need to like be aware of or kind of like anticipate?
We will talk, I'm sure, at length about, you know, side effects, potential side effects, risks, and benefits of it. In terms of like your person, are you going to become like
turn me into like a werewolf or whatever? You know what I mean?
You know, like no. In fact, and this has been studied extensively in animal models. Like when you give a chimpanzee extra, or you know, a gorilla or something, you supplement its testosterone, they actually become calmer.
Really?
Yeah.
Wow.
Yeah. And there's just their general like overall function becomes calmer. That doesn't mean that they won't have, you know, gorilla-esque tendencies of rage or whatever, but and it's been shown in people. I can admit to that as well.
Interesting.
Less anxiety, less kind of general frustrations day to day. Sure. More energy to accomplish, you know, my daily tasks and things like that, and that of course translates into less anxiety and less kind of overall worry and things like that. Like I'm handling my, you know, what I need to handle. Sure. Now, personally, I feel like the sort of rage, I guess probably comes more from the peaks and troughs than anything, particularly the troughs. And so I personally dose twice a week, and I think it helps ameliorate all you know, the nadir of hormones.
What do you mean by trough? So as it starts to wear off, then you start.
Yeah, I mean, you've got like a 4 to 5 day sort of half-life, I guess you could call it,
Right.
with your testosterone cypionate.
Mm-hmm.
Some people dose it twice a week. I don't know, or once every 2 weeks. I don't know how they do that, but you know, as you get towards when your body is ready for another dose, you may feel like you're kind of needing it. So
Like you're missing out.
You're missing out.
As the body's sort of
yeah, your
adapting to that.
levels dipping down, and
Sure.
you're kind of like feeling like you want it.
interesting.
Now when we talk about roid rage, obviously that's going to apply to someone who's using some other substances. And somebody who's on like a anabolic steroid may see their testosterone level at 2, 3, 4, 5,000, you know, compared to like a well-optimized male who's like 800 to 900.
Right.
And so that peaking and troughing that they're going to experience is going to lead to, you know, some pretty significant psychological effects.
Sure.
Yeah, and that could, you know, be a roid rage type incident. But
Just like a bigger swing, I guess. Is that like
huge, massive,
right.
massive swings, and especially like because you don't stay on gear all the time. So these guys are going on gear, getting up to these crazy levels, and then they have to go off at some point,
Right.
You know, and so can you imagine, you know, coming down from that? Every cell in your body is just like saturated with huge levels of testosterone.
Sure.
And then
all of a sudden
it's gone.
Right. Yeah.
That's going to lead to some pretty crazy
different. Okay.
behavior.
Okay. That's good to know.
I haven't been on gear, so I can't speak personally to that.
Sure.
But that's I think where that mentality comes from. Guys who have been on testosterone replacement don't describe that. They do, especially well managed TRT. They're not having roid rage. I listened to a guy at the gym tell he was a personal trainer helping somebody. He went into vast, you know, very specific detail about how you should never go on TRT because
what?
I was just like working out, listening to this. This guy has no idea what he's talking about. You know, this trainer telling him like, oh yeah, this is why you hear road rage incidents every day and stuff. I'm like, no, this is not why.
Oh, geez. Yeah. Yeah. Even I know that.
Yeah, it doesn't come from that. So yeah, I think I'd have to look at the study again, but I read something about how the monkeys who had their testosterone supplemented sort of recognized the hierarchy. They had better recognition of their hierarchical scale in their community. And and they competed with people at their same level to try to achieve the next level. That is the society we live in, for sure. You know, we compete, and it's hierarchical. So if you need the energy to get to the, you know, to work harder in your business, and this is going to give you that. This is going to get you to that level. You look at youth sports, and there's competition is a part of being a young man, for sure. And that, I think, is driven by this like burst of testosterone that these young guys get. And so while we're not like playing football or whatever, we need that edge. We need that to be able to compete at that level in society.
Right. And around what age do you guys start seeing the biggest declines in testosterone? Is it sort of like similar across the board, or is it kind of something that you can expect?
Well, in the last
or is it kind of
decade, 1 to 2 decades, we are seeing a general decrease in testosterone.
Oh, wow.
Amongst males.
I mean, more than before, more than previously?
Before. Yes. You know, and there's theories as to why that is. Hormone disruptors in the environment is probably the most likely. In addition to sedentary lifestyles and I guess, what am I trying to I'm trying to think of what it is, but you know, it's like high high A1C, which sort of pre-diabetic conditions coming on sooner and stuff. So all of this is leading to just men having lower baseline testosterone. Not only that, but lower fertility. And so, yeah, so probably in your mid 30s, especially if you're starting to have symptoms, but and supplementation is always based on symptoms rather than just a number.
Oh, right.
But like 2 decades ago, like a 38-year-old being on a replacement would have been unheard of. It would have been guys maybe in their 60s and 70s. Even then, like you were kind of expected to go into some sort of senescent decrease in your testosterone level. So,
oh, right. Yeah. I mean, I remember looking at old men and they're kind of like in their chair and it's like, oh, he's old. Like, oh, that's just part of getting old.
Right.
I think that now culturally, aren't we kind of looking at and going like, why do I have to live a life like that? Why do I have to just kind of sit there and just not enjoy life, I guess?
Our baby boomer generation is like having this really renaissance of like they're all pursuing anti-aging treatments, and there's a real interest in it, especially in our community. We live in Phoenix. We have we're surrounded by Sun City, and
sure,
it's all.
Now that's not to say there's nothing wrong with like aging gracefully. I believe that there's something to be said for just kind of like natural, just being your age, right? I mean, like I don't color my hair. I notice you don't do the same. So there's certain aspects of, getting, although some women say that it is attractive, as well as having a sweet mustache like that.
It's not a choice though. I mean, nobody wants to age, right? So,
right.
But it's more about maintaining your lifestyle and you're being able to do what you want to do as you age. And then if you suddenly keel over and die at 82,
right,
on the same day that you went out and played pickleball or went to the gym, that would be ideal, right? So maintaining your muscle mass, your bone density, your energy level, even your sex drive and ability to have sex well into your later years is ideal. That's what everybody wants.
And I know we could probably talk about this a little bit farther down the road, but with the benefits of TRT, are you aware, is insurance covering TRT, or is this just kind of something that you have to go and pay for out of pocket?
There's sort of two sides of it. One is the first answer to your question is yes, it is generally going to be covered by insurance. Like if your primary care doctor thinks that.
I don't even know if this is the right question to ask.
No, it is.
Right.
So a lot of people are asking this question, so it should be answered. But if you have a good primary care doctor who thinks that you would benefit from TRT and you're having symptoms, then the insurance would probably, pay for it. Now, whether he's going to optimize you to get you to where you're going to feel the benefit, that just depends on your doctor. A lot of people out there though, and this is sort of with it being kind of, I guess, a newer thing and something that's not necessarily endorsed by a lot of primary care or general doctors these days. Your doctor might be a great doctor and really good at managing your blood pressure, but doesn't think that you need to be on TRT. So you may want to seek somebody who does it regularly with a lot of patients, has experience with it, and is willing to kind of get you to where you want to get. Right. What I've seen is a lot of doctors will say, okay, let's check your hormones. And then you're in that reference range, the normal distribution of patients who are, okay, you're 275. The cutoff for low is 250. So you're good.
Okay.
You're good, man.
Oh, got it. Meanwhile, you're not really seeing the benefits of.
No, you could be having all the symptoms of that. And I mean, that reference range is developed over many years, many patients, but that people from the age of, 18 all the way to 90. So
you could be at 500 and still not feel you're really getting the benefits of it.
That's right. Absolutely. So, and we base supplementation again on your symptoms.
Mm-hmm.
There's 4 main areas that I like to talk about patients with, just because it helps, button it up. The first one is sex, and mainly sex drive. Okay. Healthy people have healthy sex drives. Okay. And so that's one aspect, and some of that may apply to ED as well. Although generally ED is its own erectile dysfunction. That is its own thing. But sex drive mainly. Number 2 is energy. If your energy levels are lower, and not so much low as they've changed.
Got it.
That's the main thing. Like I felt this way before, and now I feel this way.
Got it.
And that's in obviously the absence of other things that can cause low energy level. Number 3 is body composition. Okay. And so that would be gaining muscle, putting on muscle, having the effects that you want by going to the gym, and maintaining, not feeling like you are gaining fat without even trying. When people have low T, they are putting on fat, they're getting heavier. They don't know why. They're like, I don't know what I'm doing wrong, but
right here,
I'm going to the gym. It's not working. I'm not feeling the way I used to feel after the gym. So body composition. And the third one is sleep. People with low T describe, and this may be from the anxiety and some of the other things that come along with it, but definitely disrupted sleep, poor sleep patterns, inability to go to sleep, inability to stay asleep, and waking up too early and not being able to go back to sleep. But when you get somebody smoothed out on that, they feel a lot better for sure.
Oh, nice.
Yeah. We'll talk more about that and kind of get into more details and of each one of those aspects and the studies behind it.
Sure. Yeah, there's so much to talk about. There's so much to kind of go into as far as men's health goes. Yeah. But as you're describing this, I'm checking things off the list. I'm like, I don't sleep as well as I can. I've been hitting the gym.
Yeah.
And I'm not seeing the effects. Although we do have some tasty snacks in our cafeteria, our little lunchroom here. Yeah. So I got to stay away from those, obviously. But yeah.
But obviously when you get into when I describe that, when I go through that with patients, that's how it is every time. They're like, yes. And it's pretty remarkable.
Well, that's really cool. That's really awesome. All right, dude, well, you got to run now.
Yeah.
Right? You got to head out.
Thanks for this. I appreciate it.
For sure.
I'm excited to talk some more.
Yeah. Yeah, we're going to cover it all. Definitely get into it all. Cool. All right.
What's our cool sign-off line? Do we have that yet?
No, we definitely need one. We probably have to
stay classy. No, we can't. That's okay. We'll figure out.
Stay healthy. Yeah. All right.
Stay healthy, Phoenix. Peace.
Cool.